Good afternoon, everyone. This is Jessica Bagian, and I'm pleased to be with you all again today. We're going to go ahead and get started as we are very lucky to have Dr. Frank Welch from Office of Public Health on the line with us, and I want to make sure we maximize time with him to answer questions that you all have about reopening. So with that, Leslie, let's go ahead and jump in. Dr. Welch, I'm going to walk through just a couple of very basic slides, and then I'll turn it over to you to walk through some of the questions that I know we've received in advance and that we may also receive on this call. So thank you again for being with us. Leslie, if we can go into the next slide. We can go to the next one. We can go to the next one. We have the same basic opening here for y'all every time, as you know, just to make sure that all of these links are easily accessible for you. So as you all know, we talked through last week the draft public health guidelines for childcare during phase 1 that have since then worked their way up through the Resilient Commission and been approved. They were released in a press release yesterday. And again, Dr. Welch was instrumental in creating these and guiding us. And so we asked him to join just to answer questions. I'm going to do just a quick, very fast refresh of those. This is exactly what you heard last week. And then I will pass it to him to really give us a lay of the land and dig into the big hitting questions you had. Next slide. So these guidelines, which are linked here, are focused on making sure that we are stopping the spread of COVID-19. They focus heavily on hand washing, disinfecting surfaces, avoiding contact as much as possible, but especially for childcares in schools, keeping kids in constant groups so that we're not cross-pollinating across groups should someone be sick. And we'll walk through these in more detail. Next slide. The first set of key rules is around any children and staff that are sick. Anyone has a fever of 100.4 or above or other signs of illness needs to stay home. I will remind you that anything that's highlighted in blue in this document is a requirement. Anything that's not highlighted in blue is just additional resources and tools to assist. High touch surfaces need to be disinfected hourly, and students and staff and children need to wash their hands at least every 2 hours, although given all the points in time of the day that they need to wash their hands, it's likely more often than that. Next slide. Sorry, our computer's being a little bit slow in switching the slides. The second section of this guidance is about planning for isolation. So if a child becomes sick during the day, they need to go into some sort of isolation room or space, and they need to be obviously picked up as quickly as possible. We've also included the guidance on how to disinfect your building or rooms that have been used by someone who then becomes ill. Next. For many of you, this is the most important slide. This lays out group sizes. So phase 1, which is the focus of today, infants cannot be in groups of more than 5, including the adults. And for all others, they cannot be in groups of more than 10, including adults. If they are in rooms with multiple groups, they need to be separated by walls or partitions. They should not use common indoor spaces unless they're disinfected in between. If they are outside, the groups need to stay separate, but we do not require a physical barrier unless otherwise required in licensing. The main point here is whichever group a child is in during the day, they need to stay with that group so that you're limiting exposure across the facility. We also need children to pass singly through entry and exit. We need to spread out children during nap time, and any special events should be canceled or postponed for now. Next slide. For drop off and pickup, we are asking that you use a curbside drop off and pickup. If you do not have a curb that is conducive to taking children out of the car to take them in, we understand. The main point here is we need as few adults in the building as possible, and you're spreading folks out so there's limited contact. So that is the main purpose here. We're happy to work with you on the particulars of your facility, but we do not want parents unnecessarily coming into the building every day with everyone dropping off their kids. Ideally, you're doing a carpool lane where you're getting children out of the car, or parents are with social distance waiting outside with their child to drop them off to someone who's receiving them at the door. Next slide. Children and staff do need to be screened upon arrival. This includes screening for fever, including asking the parents if the children have taken fever-reducing medication, but also looking for shortness of breath, sore throat, rash, and a cough. If there are signs of illness, children and staff need to go home and not be allowed in the facility. As I mentioned, frequently touched surfaces need to be disinfected hourly. This includes bathrooms and objects that are frequently touched. We should not be sharing toys across groups unless they're washed and sanitized in between. And obviously we want to keep cleaning materials away from kids, as we always do per licensing regulations. Next slide. We here have just reminders about washing, feeding, and holding of children. We recognize that childcares are not like restaurants and you cannot socially distance with a 1-year-old, but we just have some best practice guidance here about how to make sure we're staying as healthy and safe as we can. Dr. Welch will speak to this, but the biggest question we've had is around masks. It is the expectation that adults are wearing cloth masks unless they have respiratory issues. Children over 2, the language is that they should wear masks. We understand that that's often not possible, so there is an as able, that's part of that sentence. Children under 2 should not wear masks. And again, Dr. Welch will walk through more particulars there. Next slide. Here we have a list of all of the times at which children and staff need to wash their hands. Is an extensive list, but this and mask are our greatest chance to stop the spread of COVID-19. So it is very important that we're building these practices. Frankly, they should be our practice generally in our child cares. And so this is a good chance to integrate this into your protocols if it's not already. Next slide. For food prep and meal service, we are asking as much as possible that you serve meals in the classrooms, but if they are in cafeterias, you need to clean in between. If you're doing family style, please make sure one person is plating all of the meal rather than having multiple people touch the utensils. Again, just some best practices listed here for you. And one final slide. Here we address the question we've received from many of you about vulnerable or high-risk staff members or children. We're encouraging that those staff members consult with their healthcare provider to assess the risk and to determine whether or not they should stay home. Parents, same thing if they have a concern about a child. I apologize for going very fast, but I really just want to turn over the floor to the expert who is joining us today. So with that, I will turn it over to Dr. Welch to introduce himself and to answer some of the common questions that we've received. Again, he is an incredibly busy man right now, as you can imagine, and I am extremely grateful for him joining us. So Dr. Welch, I'll turn it to you.
Jessica, thank you very much. Can you hear me? There we go. Okay, I got that thumbs up sign. So thank you all for having me again, and I really appreciate the time to spend with you all. I did receive a list of questions, and I sort of consolidated them down a little bit. In the first, and so I'll just go through them generally. Obviously, you can send any further questions to Jessica, and I would be more than happy to answer them. The first group of questions is around personal protective equipment. And, you know, of course, we want the adults to wear a mask, but a lot of these questions revolve around when exactly do they want to wear the mask. And really, I want everyone to go back to the sort of principle that we're trying to do, which is social distancing. And when we say that word, what we really mean is physical distancing. We want people to be greater than 6 feet apart from each other. So the first one is if a teacher is in a room with her 9 children, does he or she have to wear the mask the whole time, or could it be removed during certain times? And certainly, like if there was nap time and the teacher separated themselves by, say, more than 10 feet and was doing work behind a desk where the children were napping, you could certainly remove your mask during that period. If they were outside, and physically distant from the children, they could remove the mask. But again, when you are in that sort of enclosed space and within 6 feet of any child, including those times where a child may come up to you unexpectedly, we do want you to wear the mask. So again, and it's a recommendation that you wear the mask. It's certainly in the governor's order that all healthcare providers wear a mask. So I really want people to wear the mask, but yeah, you can take breaks from the mask when you're alone or physically distant from other people. The second set of the second set of questions that I had, the first one is group size and social distancing. I want to remind people, I think I mentioned this last week, that the state of Louisiana is following the White House plan for phased reopening. And the thing that we didn't do in Louisiana was that in phase 0, which is the one we were in before, in the White House plan, daycare centers were not allowed to be open. And Governor Edwards felt that that was not a reasonable thing to do in Louisiana, and that's why he allowed some daycare centers to stay open with all these limited restrictions. And that is why the change does not happen for us in phase 1. We're actually in line with the White House plan in phase 1 by allowing our limited group size. So the first question I got is, are those daycare centers who have been open, are they allowed to increase their occupancy? And the answer is no. We will be keeping the same occupancy for phase 1 to be in line with the White House plan for phased reopening. And the second question is, should employers ensure proper social distancing where multiple staff members are sharing an office? The answer is yes. Can one adult, such as a director, float between groups? We really don't want that. The whole point, as is mentioned in several of the other questions, you really can't make kids social distance 6 feet apart. So the way we're accommodating for that is limiting the number of interactions between children by keeping the groups separate, as Jessica mentioned. So we really do want, say, for example, this group of 10 people to stay together all day, including the adult. The less number of interactions we have with other people, the less chance there would be spread between groups. And as I mentioned last week, the more we're learning about children, we originally thought that children did not have much increased not only transmission of disease or incidence of disease, but the severe complications. And I'm sure you all have seen on the news that is turning out not to be true. In younger children, there seems to be an inflammatory disease associated with this. And in kind of school-age children, there's a higher incidence of stroke in children we found to have this. So our original thought that this was a benign illness in children is turning to be not true. So we really do want to limit that total group size. So the answer to that question is, I would want the group to stay together with the same adult. And again, I got a question about social distancing of children, which is, as you all know, very, very difficult. That's why the groups have to stay together. That's our solution to social distancing with children. At what age are the groups allowed to mix? They are not during phase one. We really do want these groups of 10 to stay together and to stay together all day. They should not be allowed to socialize or mix with each other at any time during the day. Will breastfeeding mothers be able to come inside a child care center? I would say yes. It would need to be a separate room for that as well, and have that mother not interact with the other children or the instructors with proper social distancing. And then the next section of questions deals with illness. What is the proper protocol if a child or staff member has a confirmed case of coronavirus? We really do need to expect that this is absolutely going to happen. Every child care provider should expect that they will see cases of coronavirus, either in a staff member, a parent, or a child. One of the nice things about coronavirus, if there can possibly be one, is that it's easy to clean away. So the first question is, does the entire center need to be cleaned? And the answer is yes, but just regular, ordinary environmental cleaning is fine for that. The virus itself can stay alive for about 8 to 12 hours possibly, but if you clean the surface, it absolutely cannot. It only lasts minutes. So with our regular, ordinary cleaning protocols that are in place for child care centers, your child care center will be perfectly fine, staying open, just knowing that you're cleaning frequently touched surfaces as often as you do. So no, you do not need to shut down. And then we talked about isolation and quarantine. If it is found that a child or an adult in one of these centers is positive, the state of Louisiana is setting up a very extensive case identification and close contact protocol. So let's just walk through what's going to happen. Say there is a 10-year-old child who gets tested for coronavirus. That test comes back positive. Very, very quickly, the system of Louisiana will be in place to contact that child and find out their close contacts. Say they are at a child care center, that child care center will be contacted and finding out what group that child was in. It is possible, depending on the level of contact, that those people in that small group will be asked to isolate for 14 days. So that is a process that is being set up that will be in place by next week and will go into practice. So it is possible that the people within that small group will be asked to isolate for 14 days. That's another reason to make sure we keep those group sizes small, to limit the amount of contact or to limit the amount of people that child came into contact with. And the notification will not be from the child care center. It will be from the contact tracing group of the state. So you all will not need to worry. You all will not need to worry about that. So let's see, I'm moving on to the next case. What should a child care center do if they're informed that a child care or staff member has a confirmed case of COVID-19 in their household? Again, that process is going to be all taken over by the state. The case will be contacted. The contacts will be contacted. The case will obviously will be asked to isolate until they're well, and the contacts will be asked to stay home for 14 days and watch for signs of illness. Department of Health lists 100 as a fever, but in the regular guidance now 100.4. We believe that that's going to move forward the fever of 100.4. Just moving on to health. Yeah, I got a question about what is my concern with the recent presentation of a Kawasaki disease-like inflammatory syndrome in young children. This is very, very concerning. As you all have seen on the news, there appears to be, in young children especially, this association with an inflammatory vascular disease, and it could be in children who do not know or never had symptoms of coronavirus, but then you test them and they come back positive for coronavirus. So again, the challenge with this disease is we don't know much about it, and some of the original assumptions that we had that, again, children were not affected, they weren't as severely affected and not having the more serious consequences, much less are they able to spread the disease. And I always liken back to influenza. You know, we know most children do fairly well with influenza. It's not a serious disease in them, but they happen to be the people who are spreading it to everyone else. So we still do not know that about coronavirus simply because it's only been around for a few months. We also don't know whether, if you've had it, whether the immunity that you've built up is actually protective. We've seen studies in China that suggest you can get it more than once, which is disappointing news. But yes, I am concerned about the presentations of this inflammatory disease in children. Again, making it more important that we stay within those small groups as we slowly reopen so that we limit the number of people who are actually exposed if somebody does turn out positive. There is a question about the presentation of this Kawasaki disease, that it is a very serious illness and a very severe disease. You would know it absolutely if a child, of course, we would not want a child who is that ill coming to a daycare center in the first place. The child would have a high fever, they would have a really bad rash, they would feel absolutely terrible. And I don't assume that they would present to a child care center. However, if a child, any child who gets ill during the day should be sent home. And then the last section of questions I got, activities, are non-vehicular excursions allowed? And I would absolutely say yes, that within your small group of 10 or whatever it was, if you wanted to go on a hike or within your small group do a non-vehicular excursion, absolutely. Water activities, that would be the same thing. I would have no problem with water activities. Again, maintaining your small group. Extracurricular providers such as Tumble Time and Happy Feet allowed to provide activities. That would depend on exactly what activity the presenter was presenting. Again, I would want them to socially distance and not have contact with the children. And then the guidance for childcare centers in phase 1 says no field trips. Again, that guidance is still being worked on simply because of the transportation piece. Buses are obviously meant to transport lots of children in a small space effectively, and that doesn't partner well with social distancing. So for the time being in phase 1, no field trips are allowed. As we move into the other phases, though, that may relax, especially as we learn more how it affects children and whether children are spreading disease and more seriously affected. But again, the field trip is based on the amount of children that you have to fit in a small space in order to get them to go somewhere. Again, those non-vehicular excursions I would be in favor of. And so, Jessica, I think I just gave a high level profile of all the questions that I received. I don't know if you wanted, I know there are a lot of people on the call. If you wanted to ask me any follow-up questions. Jessica, you may be muted. Did you want to ask me any follow-up questions?
I'm back now. It won't let me unmute myself, so Leslie was trying to get me off mute. I think it would be helpful if you could just restate the rules around mask one more time for the benefit of the group. This is the one we've received the most, as for childcare's open, for these past few weeks, they didn't necessarily have everyone wearing masks and throughout that time. So if you could speak to mask in phase 1, that would be helpful. And then for everyone on the call, if you have additional questions, I would ask that you email them to our COVID inbox or to earlychildhood@la.gov. And we will continue to work with Dr. Welch and his team to build out a more comprehensive FAQ around the particulars that continue to come in after this call.
Jessica, thumbs up if you can hear me. I don't know if I was muted or not.
I can hear you, yes.
Excellent. So I'm going to take a step back and talk about masks in general. Everyone kind of remembers that for the first several months, 2 or 3 months, the wearing of masks was not recommended. That was for several reasons. Masks were in short supply, and they needed to be preserved for healthcare providers. But in addition to that, the primary goal at that time of wearing a mask was potentially not to get coronavirus. And it has been found, and still is true, that masks really don't help you that much from getting coronavirus, meaning it is not the protective thing that is going to make it so coronavirus doesn't enter you. And the reason for that is if we touch our masks, if you touch your face and fiddle with the mask, you may get coronavirus in there. And it really doesn't substitute for those other practices, social distancing or keeping physically away from each other, washing your hands frequently, making sure frequently touched surfaces are cleaned, are much better ways of not getting coronavirus than wearing a mask. However, in the last, say, 5 or 6 weeks, we really have learned more about coronavirus, and it's a larger virus. And so what wearing a mask does, it actually prevents you from spreading coronavirus if you have it. What we've also learned is that there is a significant number of people, maybe even upwards of 30% of people who get coronavirus who don't even really know it. They may have very, very mild symptoms or no symptoms at all. So they could be healthy and going to the grocery store and going to work and coming to the child care center, and they don't even know they have it, but they still have the ability to spread it. So wearing a mask is really, for that particular person, the person who is asymptomatic but still able to spread it, what that does is it decreases the ability significantly of their ability to spread it to the other people. So for the adults who are wearing a mask, and the recommendation of wearing a mask in a child care center is, if they happen to be one of these asymptomatic people, it makes it so they are not spreading coronavirus to the children in the daycare center. Now, of course, we would want everyone to be able to do that, but as we've all agreed, it is very difficult to get a child, especially a young child, to wear a mask. So having the adults wear a mask is really protecting the children within the daycare center. Jessica, any further explanation needed on that?
No, I think that's extremely helpful. Again, I know we're at time for you and you are very busy, so we are extremely grateful for the time you've given us and thankful for your team's leadership during this difficult period for our state and country. So stay safe, and we will be in touch about additional questions that we receive. Thank you again.
Absolutely, and thank you all for having me. I'd be glad to answer any questions.
Thanks so much.
Thanks, Jessica.
All right, we'll go ahead and move on, guys. I do just want to note, though, there were a number of questions received in advance of the webinar. Our team is working to put those into the FAQ. For those that are licensing questions, we'll sign off on those. For the ones that bump up against Office of Public Health, we will be sending those to Dr. Welch and his team for sign off before we post it. But I anticipate having that up in the next couple of days, and we may just send out a special newsletter, Nasha, at the point that that's done, to make sure everyone has it if it doesn't match up with the days in which our newsletters normally go. So thank you for the great questions that everyone took the time to submit. Please keep them coming. Again, you can email LDOE COVID-19 support at la.gov. You can email me directly, or you can email earlychildhood@la.gov. All right, let's go ahead and move forward. We have a lot of additional items to cover today. I want to talk with you about an announcement that should have gone out about an hour ago for what we're calling Strong Start 2020. We rolled out a version of this for pre-K-12 2 weeks ago. Today, we are announcing the early childhood version of Strong Start 2020. And what we mean by this is it's a grant opportunity